The latest Ebola outbreak is outpacing the response, and the International Rescue Committee now predicts it could become the deadliest outbreak of Ebola on record.
Before we get into today's conversation, I need you to stop what you're doing, because what I'm about to tell you is not distant, it is not abstract, it is not an African problem. There is a global public health emergency declared by the World Health Organization, and it is already knocking on America's front door. I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So what's happening in the world? Ebola. And what do we do here in the United States? What are we actually doing? Remember, the United States is the same country who walked away from the World Health Organization a year ago. And we are also currently the organization known as the CDC that's supposed to be protecting us is falling apart. Let's roll this clip.
There's no vaccine, no treatment. Behind it all is a global health funding architecture at its lowest level since 2009, with the largest single donor, the U.S., having walked away. A recent shift in U.S. health policy now has the U.S. keeping suspected American cases abroad, sending some to quarantine facilities in Europe, others to Kenya. Why can't they be treated back home?
So, Dr. Brown, on May 15th this year, the Democratic Republic of Congo, the DRC, officially declared its 17th Ebola outbreak. So that's number 17. And so we want to talk about that. The first known suspected case was a healthcare worker in Ituri, Providence, whose symptoms were fever, hemorrhaging, vomiting, intense malaise, which is basically sort of like fatigue. That all appeared on April 24th. The worker later died in a medical center in Bunia. Think about that. A healthcare worker, one of the people on the front lines protecting their community.
So on May 16th, 2026, the WHO declared this outbreak a public health emergency of international concern, a PHEIC, the highest formal alert in the global health system. As of May 27th, there are more than 1,200 suspected and confirmed cases and at least 264 deaths reported. And researchers believe the true number of infections could considerably exceed those reported figures. The spread has gone beyond borders. The outbreak has now been confirmed in the DRC's Ituri, Nord Kivu, and Sud Kivu provinces, and 5 cases related to the DRC outbreak have been reported in Uganda's capital, Kampala. So we want to make sure our listeners understand that it is not the same Ebola we've seen before. What is the Bundibugyo virus, and why does it matter that it's this strain? Dr. Sloan?
It's a rare strain of Ebola, and it's very alarming. The truth here is that there's no licensed vaccine, and there's no specific treatment for it, and that's what's scary. The existing Ebola vaccines were all for a different type of species, sort of like, how we had all these different types of COVIDs. The scientists are now urgently, assessing whether they can play any type of role at all in this. The 2 main lines of defense right now against the deadly virus are vaccines, a monoclonal antibody treatment, and currently there's no approved treatment for this virus, what we're calling a BVD. So the case fatality rates right now are almost at 30 to 50%, unlike those in Ebola Zaire, the strain with an approved vaccine. There is no licensed vaccines right now, no specific therapeutic against this virus that we know. So through early supportive care remains the only life-saving thing that we can do. So sort of scary, right? There have been only 2 prior BVD outbreaks, one in Uganda in 2007, and then also in 2008. And then there was also one in the DRC in 2012. So the previous Ebola crisis drove major scientific advances, right? With vaccines and treatments developed for the Zaire strain, but not this one. So no approved options exist so far, Dr. Brown.
So, this is why the World Health Organization is calling it unprecedented in its current scale. So last week, the WHO convened leaders of partner organizations under the Interim Medical Countermeasures Network to review the pipeline. WHO has recommended prioritizing 2 monoclonal antibodies for clinical trials and is also evaluating the antiviral Obeldesivir is post-exposure prophylaxis for high-risk contacts. So science is moving, but we aren't there yet. Let's just run that next clip.
We turn now to the Democratic Republic of Congo in efforts to contain the Ebola outbreak there. In the last few days, 3 treatment centers have been attacked. This includes 2 that were set on fire. The first was on Thursday. We talked to you about it then, after family members were banned from retrieving the body of a man who had died from Ebola.
So, the attack on several Ebola facilities is for various reasons, but the most important one is the spread of this virus and the death toll in its wake. So, Dr. Sloan, people hear this term BSL-4 in the news, and they don't always understand what it means. Can you break that down for us further?
I believe we really are just now starting to hear about it, right? So BSL stands for Biosafety Level, and there's 4 different tiers. And this chart here sort of explains the basic ones, right? So 1, 2, and 3, you guys have heard about some of these, but once we get to the level 4, that's the highest level of contaminant. Employees wear positive pressure encapsulating suits, breathe filtered air as they work, a combination of rigorous training, meticulous procedures, security measures, carefully designated structures, and elaborate redundant operating systems in place to protect the laboratory workers and other people in the facility, right? So this is serious.
It's problematic, right? Because heat, pressure, and chemical systems housed in the labs process and decontaminate all solid and liquid wastes. And air passes through high efficiency particulate filters before leaving the facility. Ebola, all strains of Ebola, including Bundibugyo, is a BSL-4 pathogen. So that means the only labs in the world that can handle this virus live behind those suit-up protocols. And there are currently 13 operational or planned BSL-4 facilities within the United States, and 2 of them are right in Dr. Sloan's Texas.
Wow. In fact, I don't even think I knew this. I went to medical school at one, the Galveston National Laboratory, which is at the medical school, UTMB, University of Texas Medical Branch, is one of those 13 to 15 BSL-4 facilities in the United States. And that's the largest located on the academic campus in the world. What? So Texas Biomed Research Institute, there's another one in San Antonio in Texas that also houses the nation's only privately owned. I wonder why they need to have a privately owned BSL-4 maximum containment laboratory, where scientists are advancing vaccines supposedly against these Ebola virus. So yeah, this work is happening right here in the state of Texas. And I guess I should be a little bit more concerned, Dr. Brown.
Let's bring it even closer to home, because this is not just happening in the DRC, right? This is also happening at airports in our country, including one in Houston, Texas. Please roll the clip.
We now turn our attention to Bush Airport, which became one of several airports across the country to screen U.S. passengers for Ebola overnight.
This comes after the deadly outbreak in Central Africa and the travel ban for non-U.S. citizens at the center of the outbreak. The Congo, Uganda, and South Sudan.
This is a sigh moment, Dr. Brown. So Erica is actually one of my friend reporters here in Houston. And yeah, that's right. Right here in Houston, my hometown, George Bush Intercontinental Airport is one of the 3 United States designated to screen airline passengers traveling from Africa countries affected by the Ebola outbreak. So this comes, you guys, 2 weeks before FIFA, and the DRC their soccer team is going to be playing here in Houston. What? You guys, this is supposed to be the largest anticipated gathering Houston has ever seen. And we've done Super Bowls, right? So Washington Dulles International Airport is the other, and Hartsfield-Jackson Atlanta Airport is also one, which is one of the busiest airports in the country. And all of them are going to be screening the passengers from DRC, the South Sudan, and Uganda. The Department of Homeland Security posted a federal register, right, to notice outlining the redirection of affected travelers to Washington Dulles that was May 20th, just like a week ago or so, for enhanced public health screenings. So what does that include? So the travelers will, those that are coming from the DRC, Uganda, and South Sudan will, in the past 21 days, if they've been in flight and they're scheduled to travel, going to be contacted, and they're going to have to rebook to a different designated airport. But if they're coming through now, in the past 2 to 3 weeks, they're going to be asked to fill out a questionnaire, a brief questionnaire about their travel history, their symptoms, and their contact information, according to the CDC. And after completing that form, the CDC people will basically screen the travelers for signs of fever and chills and whatever else, sort of like what they did with COVID, right? But those without symptoms can continue to their destination in the United States. But they're supposed to monitor their health, right? But then there's some travelers that may have symptoms are going to be further evaluated by the CDC public health officers, and the CDC will coordinate the state and local health agencies to ensure appropriate care if needed. The same CDC that's broken right now, Dr. Brown.
Right, the same CDC that's lost a large percentage of its workforce, right? So the CDC has invoked Title 42 to restrict entry for non-citizens who visited one of the countries within the previous 21 days, along with screening and monitoring of all people arriving from these countries. An American who tested positive for Ebola on May 17th is amongst those being moved for care outside the DRC, with the CDC working with other U.S. governmental agencies and international partners on those efforts. So to date, no suspected, probable, or confirmed cases of Ebola have been reported in the United States, and the risk of Ebola domestically is considered very low. But speaking as a physician, low risk does not mean no risk. And our communities, right? Our communities, the ones in Houston, Atlanta, and the DC metro area, we are in cities where these screening protocols are active. So we need to be informed, not afraid, not scared, not some, crazy reaction. We need to be informed, right, Dr. Sloan?
I totally agree.
So when an Ebola outbreak erupts and the media begins talking about, quote, travelers from Africa, end quote, we need to be precise and we need to be vigilant, because the framing historically leads to stigma, right? Not safety. It leads to fear. In 2014, during the West African outbreak, that there was documented fear, discrimination, and racial targeting of African immigrants and Black Americans across the country. So we do not need to repeat that chapter. Our job as Black and Brown women disruptors is to lead with science and facts, to be the trusted voices in our communities and in our families. Because when our friend or family member shares a post on Facebook that says this was manufactured, or when your neighbor asks if Black people are more susceptible, we need to be prepared to answer with facts, with grace, and with authority. So practically speaking, what do you need to know? What do they do? And so here's our action list. Number 1, if you or someone you know has traveled to the DRC, Uganda, or South Sudan in the last 21 days and is experiencing fever, severe body aches, vomiting, or any bleeding, do not wait. Do not go to a walk-in clinic. Call your healthcare provider first. Call the CDC hotline. Alert them before you arrive anywhere, right? This is a standard protocol for any hemorrhagic fever exposure.
Right. And then number 2, Ebola is a disease that spreads through direct contact of bodily fluids. So a person becomes infected if they have a broken skin or mucous membranes like their eyes, nose, or mouth comes in contact with an infected person's blood, urine, saliva, or other bodily fluids that are contaminated, objects such as surgical instruments. It's not airborne virus like COVID, you guys. You cannot get it from being on the same flight as someone just sharing a building space or room, right? Understanding the transmission is very key to fighting the misinformation, you guys. And then number 3, trust the BSL-4 system. And we have 2 of those here in Texas, and there's approximately 13 others around the United States. The scientists in those facilities, many of them are women of color working around the clock on this. And so your government, through the CDC and the NIAID, engaged internationally, but not with the World Health Organization. I digress. This is not the whole story, right? But it's a piece of the truth we need right now. And lastly, 4, watch for racial profiling about screening checkpoints. And it's coming, I promise you. If you witness or experience discriminatory treatment related to the Ebola screening, document it and report it. The ACLU and local civil rights organizations have different resources for you. So right now, to dignity does not expire in the public health emergency.
So, we open today by saying that this is urgent, and it is, but urgency does not mean panic. It means presence. It means awareness. It means that we show up informed, equipped, and unafraid. So Black and brown women have always been the backbone of public health in this country. And we've been the community health workers, the home nurses, the ones who make sure grandma took her medication and that our cousin down the street got vaccinated, right? So that role does not diminish. It actually expands when a global emergency arrives. So the Bundibugyo Ebola outbreak is a PHEIC. It has no approved vaccine. It has no approved treatment. And it is in 3 provinces of the DRC. It has crossed into Uganda and U.S. airports in Virginia, Georgia, and in Dr. Sloan's home city of Houston. Right? They're actively screening these travelers. So science is at a BSL-4. Red.
Red means stop. So that means you need to stay informed. That means share accurate information. Trust the science, you guys, because we're AYA. We're contributors to MeidasTouch Network and proud members of the Meidas Mighty. And we want you guys to repost this, share it, subscribe, like, and follow for more updates. Have a great week.
Thanks, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.